Greiwe. I'm a shoulder, elbow, and sports medicine specialist, and today I would like to talk to you about impingement syndrome. Impingement syndrome actually has multiple names. One is rotator cuff tendinitis, and then another one is shoulder bursitis. They all basically mean the same thing. What it is, it's an irritation of the tendons of the rotator cuff that live right above the shoulder. And the rotator cuff is involved in lifting our shoulder. And many people with rotator cuff bursitis or tendinitis or the so-called impingement syndrome get pain as they lift their arm, or when they reach behind them to pick up something in the back seat of their car, they may notice some discomfort around the shoulder. Generally speaking, the discomfort is really down the lateral aspect of the arm, but they don't have weakness. Classically, weakness occurs when you have a rotator cuff tear. So if you're noticing pain down the lateral aspect of the arm and you notice that your arm is heavy or weak, that's a little bit more concerning. But rotator cuff tendinitis or impingement syndrome occurs due to a small bone spur that typically lives right up above the shoulder's rotator cuff. And when the ball rides up in the shoulder and the rotator cuff tendons hit that small bone spur, it causes pain and inflammation. And so patients will get this pain down the side of the arm. Well, if this is you, you want to know what to do about this. And what I would suggest maybe doing is to start with an anti-inflammatory and get with a physical therapist to see if you might be able to improve your strength and improve some of the pain that you have. If that doesn't work, you may want to consult with an orthopedic surgeon who could potentially put a small injection into the shoulder around the shoulder's rotator cuff tendons so that you can improve some of the pain that you're having. That may allow you to improve with what you're doing with physical therapy. Most of the time, this particular problem does not need surgery. It rarely needs surgery, actually, and in my office, I probably operate on about 5% of the impingement syndromes that I have. So hopefully that gives you a good bit of information on what to do if you have impingement syndrome. Please contact us if you have any further questions at www.orthonky.com. I'm Dr. Mike Greiwe, shoulder, elbow, sports medicine specialist at Commonwealth Orthopaedic Centers.